I have been using the Isolite system ever since I left residency, which is almost 5 years now. And I could not do what I do as a pediatric dentist without it. The big thing for me, if you think of dentistry from the beginning to the end, prepping a tooth can be very hard with children because they're just busy. They're busy bees. They have busy tongues, they have busy cheeks. And so from even the prepping of a tooth, you have so much better control with an Isolite system. Kids are busy in terms of cheeks and lips, but like biting, they like to bite during a procedure. And so it just kind of stays in place better. When we go to restore a tooth, I mean, saliva, everything really can affect the longevity of your restoration. And so having something that's suctioning, as well as retracting, ensures that you're placing the best restoration possible. I know that my field is dry and that my assistant can either hold hands, pass instruments faster, whatever we can do to get through that appointment as quickly as possible is great. We can do 2 quadrants at the same time with children, and that's helpful for 2 reasons. One, you get through an appointment faster, but if you use materials like a capsule, like glass ionomers, resin modified glass ionomers that come in capsules, you can do 2 teeth in different arches, and it saves you, financially, because you're using less material when you get to do 2 teeth in opposing quadrants. So there's so many benefits to the Isolite in general, but specifically to the pediatric size. Kids, traditionally in pediatric dentistry, we use rubber dam clamps, and that can be kind of uncomfortable. I definitely notice more, or I should say less, post-op discomfort when we're using an Isolite over a rubber dam system. And so to have a well-fitting pediatric Isolite size that you can use on as young as 3-year-olds, if that's going to improve their post-op discomfort, I mean, that's wonderful.